It uses a bone expansion brace to cut the bone tissues. After they withdraw that brace, a mesh container is advanced to the cavity, and once again, we're using cement. So all these procedures do use cement, they're just all done in different ways. This will restore vertebral body height and strengthen bony trabeculae. So I guess, Jay, if you're looking to expand that vertebrae to get taller, there's your gold star procedure there.
I can finally be 6 foot.
Not as good as it sounds. It's really not.
See all eye to eye.
You just hit your head on more stuff. Trust me. Sucks as an X-ray tech. I've hit my head on the tube so many times. Which is why everyone got mad at me because I always put the tube way up high. And we'd be like, John, come move this tube back down. Why'd you do that? Because everyone I worked with was short. So
Jump, tell them to jump.
I should have, huh?
Yeah. Miss, in fluoro, I always put the little thing at the end after like wiping down the table, too high for Miss Dahlia, so she like comes back in the room and goes, Jay! You gotta let me know when the next exam is.
Okay, a couple other.
There you go.
Oh, you got that?
You're like, you ain't running away from today.
You're not gonna be quiet today.
I'm not saying anything. I'm silent on that one. Some other neuroradiographic procedures. We have a provocative discography, a very controversial procedure.
Oh.
That's what's called the provocative discography. That's a really bad joke. I'm sorry.
Provocative
I'm
disco?
running out of material, guys. You're almost graduated. You about utilize all my humor. I don't have much left. That's about all I got left. I know that was grown worthy. Then we have interventional pain management. So
I should have gotten that a couple seconds ago when you gave us that joke.
Huh? So here's your provocative discography.
And then I needed.
Here's your very offensive discography. Your provocative discography. Isn't that just offensive? Man, goodness. Horrible.
What the hell?
Someone very provocative. All right, so that's under fluoro guidance. Once again, we're going to use that to determine if the disc is the source of chronic back pain. So both these procedures are for pain procedures to try to relieve pain in the patient's back. So
these are tears, and they're injecting contrast into them?
these are inside the actual disc. They're putting little contrast pockets in the disc. So that's what we're about to talk about next. They're going to put a small little bit of non-ionic media in there in the center of the disc, and they'll see if there's been a rupture or a tear of the actual disc, specifically in the nucleus pulposus. Nucleus pulposus. Don't y'all remember that was my favorite word during the spine chapter, the nucleus pulposus? I thought y'all were never going to see that word again. It came back. The audacity. So these are both injected in the nucleus pulposus. Just a little bit of contrast, and you'll look to see if it's leaking out anywhere, if it's flowing into anywhere else in the disc. If it is, they can tell that's the source of the back pain, a ruptured disc. Pretty cool procedure. Not as provocative as it looks, right? You think with a name like that, it'd be something extreme.
That was last chapter.
Yes, indeed. Okay, then interventional pain management. Have any of you all done these procedures in IR?
Not yet.
Interventional pain management. So that's a treatment that we do in radiology for chronic back pain when they do not respond to regular medications. So they're going to insert a needle using fluoro, CT, and ultrasound. They're going to introduce corticosteroids and local anesthetics to reduce inflammation and improve those symptoms of that back pain. They'll do it at all levels of the spine. They'll do facet injections, nerve root blocks, and epidural steroid injections. That's for your chronic back pain patients where they can't find relief for any of that back pain under normal medication. This will only give temporary relief, by the way, for a period of time. So we'd have to come back and continuously have this treatment done to keep that back pain from remanifesting.
Is it as effective every single time you go back? Does it lose effectiveness?
It varies. From what I'm told, it varies between the patients. Depends on how severe that back pain is.
So they
and
can
where the
build a
source of it
tolerance?
is. Huh?
They can build a tolerance to the epidural?
Theoretically, yes. As with any drug.
Druggies.
So anybody want to get your steroids done? There's your IR procedure to get your steroids. Stay off the steroids, huh? They don't only put it in the butt cheek. This is directed around the spine, injected around the spine. Butt cheek's the most effective place though for steroid injections.
Wait, what?
Yummy.
The butt cheeks, that's the best place for steroid injections. It absorbs in the bloodstream quickest.
Yeah, you know, like when you go to the doctor and they give you a steroid in the butt cheek.
Nah.
You never had one of those?
Nah.
What you been doing?
You over there pumping roids?
No.
She said,
HIPAA? Question mark?
oh, I'm nervous now.
If I come to
Figure
school,
out.
Everybody's all roided up.
Lower your pants.
No.
Thank you.
Roid rage.
Give me my record.
Give my roids.
I'm sorry, y'all.
You
ain't
getting no
steroid shot, girl.
Hey, and especially not my rump.
You need something else.
Whatever, I felt better after.
Oh.
Oh, of course.
No.
Are y'all sure y'all want to graduate next semester? Y'all getting way too interesting for me to let y'all go yet.
Just fail us all. See what happens.
Okay. Y'all getting way too entertaining.
Sure, I got so mad.
Hey. Don't wish that. You know what that was? The equivalent.
Hey! The answer's A.
The answer's A. Are you sure about that? The protective covering of the brain and spinal cord is the what? The meninges, correct. Meninges. That's a fun word, meninges. This should not have been in here, but good to know anyway.
Cerebrum.
Largest portion of the brain is the what?
Cerebrum.
Cerebrum. White matter surrounds the central gray matter tracks in the spinal cord. True or false? I think it's false.
False.
It's actually true.
I thought gray surrounds white.
White surrounds gray. Gray's in the
Oh.
center.
Oh, yeah, that's right.
That
Like a
is a good fact to
butterfly.
know. That is a good fact to know.
Great man.
White comes before gray.
Test question?
Phrasing?
That's so
question.
true.
That's what-
Right, that's.
You said gray
Gray's in the
Gray's in the center. How many pairs of spinal nerves connect to the spinal cord?
Bad boys popping my head.
How many pairs? Keyword pairs.
You see, when the correct is
24 or 60.
It's actually 31.
31.
It's 31. You don't need to know this one.
So 62 total.
You don't need to know this one. That's when you come back to CT, you do need to know that
Oh,
one.
you trying to
Bonus
be bad
question.
too.
You really
I'm
trying
giving
to
y'all some
push
previews, yeah.
CT down.
You don't want to do CT?
He's gonna take your money.
Not mine. My CT class is awesome.
I heard bad things.
Oh, you have?
Oh.
Who told you that?
What you been doing?
Who are you talking to? Only got 3 students.
Mr. Donahue?
Oh, dang.
Yeah.
Do you have a class today, like this afternoon, or
Yesterday, I had one last night.
why is Jalen here?
Jalen's here?
I saw him walking in the building earlier today.
I have no idea.
Oh, he didn't
You know, he
get
doesn't
your
talk to his father anymore.
ID?
He's a big shot now. He's at MD Anderson. He's a tech. He never calls his dad anymore.
Oh.
Yeah.
You never even pick up the phone. Well, at least you never pick up the phone. I know.
I got you on auto block.
That was
Oh.
Be prepared. What time you go to sleep at? By 10?
That was big old
Yeah,
doubt.
so that they can just buzz. Why?
What is up with your
This
phone?
class
I called
is-
the other day.
You never pick
I'll
up.
tell you why. You always call me when I'm in the middle of a class.
I'm gonna call you 11
So you
a.m.
had it on like do not disturb or what?
So I'm not calling
No, I just let it run.
No, we look at it, it's radio. Send the voice job.
I get.
You know what Mr. Fung does?
I get every
Oh,
message.
guys, I have to take this.
You don't ever reply.
He just
I
doesn't
said,
respond to
"Well,
the
I'm reply
message.
to regular
Mr. Fung
messages.
prioritizes
Monday."
us.
I will tell you why.
That's
Well,
nice.
regular messages I just respond to the least because
I've
they
seen
get buried really fast. I get
That's
text
somebody
all
else.
day.
That ain't us.
That
So
was
like,
a junior.
if you text me in the morning,
Yeah, right.
your text is way down at the bottom by a few hours. So stuff like WhatsApp and all that, I get less on those. So don't text me on WhatsApp.
I'm gonna call you today at 11 p.m.
Hmm?
Wake you up.
Are you now? Oh, what a shame. My
You're gonna be
ring,
going straight to voicemail. It's not even a ring.
the buzz is off too.
This phone number has been disconnected.
My alarm sounds, but everything else is silent. For that specific reason, 'cause I used to have students try to call me in the middle of the night, get on my nerves and wake me up. Yeah, don't call me after 9. That's not right.
It's not professional.
That's not
That's not right that you
professional.
don't pick up my call. Actually. What time do you wake up?
5 o'clock.
One time I texted you at 6:30. You didn't answer.
It's probably because I was driving.
Me too.
Well, text me drive. I drive responsibly. Anyway, what were we talking about here? For that diversion. The rad examination of the CNS structure situated with the vertebral canal, situated within the vertebral canal, via injection of the non-ionic, water-soluble contrast medium in the subarachnoid space is termed what?
Myelography.
Myelogram, obviously. MRI of the brain. Why are we talking about MRI of the brain? You don't even know that. That's a Mr. Phone question. How'd that get in there? Okay, here's a good one. Bone cement is injected into the vertebral body for all the following procedures except what?
No,
Vertebroplasty. Oh yeah, I'm sorry. D. Discography.
What is discography?
Something you made up.
Top of the disc. Oh, that's where you put
That's-
the.
It's in the,
That's to relieve pain. That's to relieve pain.
That's the interventional
Check
pain
for nucleus
management.
pulposus
That
tears.
right there, say it again.
To check for nucleus pulposus tears.
That's the one that's inappropriate, right?
That's the provocative discography.
Provocative.
Yes. Myelograms are performed by introducing a non-ionic contrast medium into subarachnoid space by spinal puncture. Most commonly at what interspace level? More than one answer may apply, but there actually is just one answer.
On here it says 2.
What's
Yeah,
2?
that's 2.
It's L2, L3.
It should be L3, L4 actually. That's the most common spot. So L2, L3 would be, there is a debate in the books on that, I will say.
Von Traeger's
But
and
yes,
Okay.
the most common site is universally 3 and 4, but 2 and 3 may also be used, so you probably really, per curriculum, rate them at the same level.
so since there's a book
They
discrepancy.
won't
on
ask
it-
you that.
Okay, cool.
They will not ask you that,
And if they
correct.
do,
If the ARTs tell me the truth, they should not ask you that.
but if they do,
If they do, let me know, because I'm gonna issue a complaint.
okay.
Because that's what they told me directly. I talked to their representative at the last conference I went to.
Give you the test.
I wish. All the following interventional procedures are used to treat spinal osteoporotic compression fractures, except what?
Discography.
Disco- Why are we all hating on discography? I'm telling you. I guess it's so provocative, right? It offended everybody. Okay, which of the following imaging is commonly performed after discography to look for clefts or tears? Which one do you think? We didn't talk about this, but which one do you think?
Yeah.
It is CT. It is CT. All right, our last area to go over here, guys. This is not going to take long. It's a very small section.
Where is this at?
We're talking about orthorhynchographies.
Oh,
Orthorhynchographies?
They gonna get Rinkin
Orthorhynchographies.
in there, right? Ortho
The long bone word?
Long bone studies.
Oh, I got it.
CT scanogram?
Long bone studies. So these are done primarily, not only, but primarily done on pediatrics. Typically, if one leg is longer or shorter than the other, they'll do these long bone studies to check to see if they can add to or file down the legs to make them at equal height. It's done usually prior to a surgery, or some people just grow out of it naturally as well. Some of your patients, they're scoliotic as well. If you ever notice that someone who's scoliotic and never gets it fixed, sometimes one leg will be shorter than the other because their hips kind of sit at an angle. So they'll do these long bone studies once again to see if everything's growing properly, because as you can imagine, if you're walking for years with one leg shorter than the other, you can actually cause a lot of joint pain and a lot of erosion of tissues and a lot of fractures as well to those bones. So long name, but simply put, this is a long bone study. Long bone study. We can do these for the arms and for the legs, by the way.
What chapter this in? What is that?
I'm not sure if this is actually in a chapter. I just know they still ask it in the curriculum. So I put it in here for y'all.
I think
No,
it's
there-
in that biliary and the long bone.
Is it on that
The last
chapter?
part. It's in the
Did they put it with that
biliary.
section?
Yeah.
Well, there you go, okay.
Thank you.
Why is it with the
But
biliary?
this
That's
slide isn't on
random.
there.
That's kind of random.
I don't think you have this. This slide's not-
Because this is from a different,
Oh, there it is.
this is from a different source. This is from a different source. So I'm gonna send all this to you. Okay, clinical indications for orthorhynchograms: back pain resulting from leg length difference, developmental abnormalities or anomalies, epiphyseal
Epiphysis.
epiphysiodesis.
Is this from the epiphysis?
Epiphysiodesis. That's a procedure to shorten the limb and bone lengthening surgery. I used to watch these a lot. Bone lengthening surgeries. How do you think they do these, by the way? Does anybody know?
They break the bones out of it.
They do, actually. They do. They will break the bones. Sometimes put a device inside of there to
Like stretch the
lengthen the
leg.
bones, or they'll take bone from another part of the body and add to the long bone to expand it. At least the ones I used to watch, that's what they did. Pretty fascinating stuff. Okay, so when we do these in X-ray, most commonly these days, you're going to do these on a machine that stitches your images together, much like a scoliosis series. Have y'all done scoliosis where they stitch them together into one film?
Yes.
Have y'all seen those?
Mhm.
They will often use these for long bones as well, but we're going to learn the ones where it's just all separate IRs. That's how the curriculum still wants you to know it. So we'll do 3 exposures. The CR will be centered to each joint, and this is a gold star question, registry. We're going to use what's called a Bell-Thompson ruler for each of these exams. Reason being that it'll make measurements of all those joint spaces on those x-rays. So, based on what you see right here, these 3 exposures are going to be what? A hip, a knee, and ankle. If I was doing an arm, where do you think they would be? What 3 places? Shoulder, elbow, wrist. Shoulder, elbow, wrist. But we're going to use that Bell-Thompson ruler with radiopaque markings beside the limb. Okay, so for lower limb, we're going to do an AP hip, AP knee, AP ankle. APs only, by the way. We're not going to do laterals. Ruler will be placed beside the limb. We're going to keep them really still. First film will be at the head of the femur. Simple as that. Head of the femur for that AP hip. Second film, right there at the knee joint with no angle. Right at the knee joint. And what's going to be just separate films. Separate films using that ruler on each of them. And then CR at the ankle joint. Right on that ankle joint.
My favorite scene.
You like that scene?
Yeah, I do. Well, I like that particular when he does that and does everything. He comes from behind it and he's like, basically like, what's up? He's like, let's do it. And he's like, okay, all right, you want to do it? Come on.
I'm hoping if everything falls in place, we're trying to take the kids to Universal this December.
Man,
So if I get to see all the Harry Potter stuff, I'll take lots of pictures for you.
do that.
Yeah, we're hoping that works out, so.
That is my thing.
Okay, guys, if we're doing an upper limb, once again, 3 separate exposures. We're going to AP shoulder, AP elbow, AP wrist. So for the AP shoulder, CR is right there at the shoulder joints. Arm extended and hands supinated. So we're going to do an external rotation shoulder for this one. External, I should have asked you that for a question. I gave away my question. That's a good question. External rotation shoulder, the AP shoulder. How are the epicondyles situated for this exam?
They're gonna be
Parallel to the IR.
You said external only?
External only. Then for the second film, AP elbow, right there at the elbow joints. And where do you think the last one is? At the wrist, which for some reason I don't have in there, but right at the
You
wrist.
showed them.
Right at the wrist for the third one. So for your image review, keep in mind, you're probably gonna have maybe a hip, a knee, an ankle, a wrist, an elbow, or a shoulder on there as well. So brush up on that anatomy, you should know those already anyway. Should be easy points. Or I might just have an entire long limb on there for you, all stitched together. I'd lean towards the latter. I'm just saying. I can feel it. Can you feel it? Apparently not, because no one responded to that. Okay. There they are side by side. And here's what they look like with stitching. This is what most of your modern machines are going to do, guys. Much more efficient, as you can imagine. You would just basically hold the button down. It will take the 3 exposures, and the computer will run that through an algorithm and stitch all those into one single image like you see right here. If I was going to guess the kind of image you're going to get on your image review, it would look more like this. I'm just saying. So this person has had multiple surgeries. Trying to expand those bones and restore some integrity into their life, some quality into their life, not integrity. What did I say integrity for? Some quality into their life. Wow, my brain's dead today. Goodness.
They look tall already, sir.
Huh?
Like they look tall already. So why do you want to add?
Can't really tell. Well, they're uneven.
I said.
Look over here.
Fix it.
This was the original. All right, there's just another one there on the left. That's the result of some of that bone lengthening surgery. They had a total hip replacement and a total knee replacement, and they're relatively even. That would be a long bone measurement study. Ortho-Rinkenground. Ortho-Rinkenground. And we made it through that chapter. That's all we need for that one.
And that's all, folks.
That's all, folks. Okay. Do y'all need a short little break before we do the review?
Yes,